Okay, I'm not going to take any time at all. I'm Jeff Weber. I'm the Deputy Director of the Perlmutter Cancer Center. And this morning we're going to hear in sort of a logical sequence from a number of physicians who are experts and our outstanding nurse practitioner who are experts in the field of melanoma care and research. And we're going to start in a logical way. We're going to start with the dermatologist. We're going to go on to the surgeon, go on to the medical oncologist, talk about side effects, and then we're going to talk about survivorship. And we'll be done, I hope, on time. And first is Dave Polsky, who's a professor of dermatology and pathology. He's actually a very smart guy with quite a head, so that's why he's the Kopf professor of dermatologic oncology. So David, take it away. It's all yours.
Great. Okay, thanks very much. Thanks, everybody, for coming out on a Saturday morning. I'm going to get started. I was asked to talk about sun exposure and melanoma, and being in dermatology, we kind of see the patients who are at high risk for melanoma to try to catch melanoma early. Of course, sun exposure is very important in what we do. So just an outline briefly, wanted to go over with you the data that associates sunlight with melanoma. How does sun exposure actually cause melanoma? A question, why do some people get melanoma and others don't? And then finally, a couple of thoughts on how can we protect ourselves from the sun. So first, some background on melanoma. You can see here in this panel, this is statistics on cancer new cases in the top and cancer deaths in the bottom. And you can see here that melanoma among men is the 5th leading cancer behind prostate, lung, colon, bladder. And among women, it's the 6th leading cancer behind breast, and again, lung and colon and others. But fortunately, it doesn't show up in this panel on the bottom, which is the top leading cancer deaths, and that's because most of the time, when it's caught early, it's cured by surgery. But of course, that doesn't happen all the time. We expect in 2017 about 87,000 new cases of invasive melanoma and 9 to 10,000 deaths, somewhat more in men and then in women. The lifetime risk of developing melanoma averages for the entire population about 2.1%. It's higher in white populations because white people don't have as much sun protection as darker skinned folks. So you can see the lifetime risk is higher in whites, 2.5%, and lower in Hispanics and blacks, but of course not zero in those groups either. And the average age of diagnosis is about 63, and that's kind of crept up over the years. But on this slide, you can see that melanoma really is quite important because on average results in about 17 years per life lost. You can see breast cancer among the major cancers is highest with 19, melanoma at 17, but more years of life lost than colon, lung, and prostate cancer. So how does sunlight contribute to melanoma? Well, what you can see here on the left side is a cartoon of the sun and the wavelengths of energy that come from the sun, which include infrared, which warms the planet, visible light, of course, and then ultraviolet, which is what we're concerned about. And that comes in varying wavelengths that are categorized as A, B, and C. And then on the right is a cartoon of the skin, and you can see that ultraviolet C up here basically doesn't penetrate down to the Earth's surface. It's blocked by the ozone layer. You might get a little ultraviolet C up at high altitudes, perhaps, or in areas where the ozone layer is thin. But we're really concerned about ultraviolet B, which you can see penetrates to the uppermost layers of the skin, and ultraviolet A, which can penetrate more deeply. So what goes wrong in the skin after years of sun exposure, UV exposure? Well, photoaging, okay, so wrinkling and thickening of the skin and mottled pigmentation is, of course, quite common. And then skin cancer is the result of unrepaired DNA damage in the skin. And you can see a melanoma here and a basal cell carcinoma here. And so I mentioned both melanoma and basal cell carcinoma. This is a cartoon of the skin, are common forms of skin cancer. So you can imagine these ultraviolet rays, coming down through the skin and causing damage to these cells here. And you can also get squamous cell carcinoma as another common sun-induced skin cancer. So here's a quiz. Who is more likely to get melanoma? On your left side is a farmer, so somebody who works outdoors for a living, gets a lot of sun all the time. And on the right is someone who's a kind of weekend warrior type, who's out there water skiing, not for a living, but just for fun. So how many say the farmer is more likely to get melanoma? Okay, and how many say the water skier is more likely? So we got a A little bit more for the water skier. Okay, well, we'll keep going and you'll find out the answer shortly. So, how did we figure out as a field that sunlight was associated with melanoma? Well, epidemiologists do what are called case control studies, where you compare patient population, which are called the cases, so in case melanoma, with individuals with no history of melanoma who are the controls, and you look at the frequency of their exposures to the agent under investigation, in this case sunlight. And then you estimate the magnitude, the size of the association between the exposure, like the sunlight, and the chance of getting the melanoma. But you have to be aware that these are what we call association studies, and that doesn't alone prove causation. So just because they're associated doesn't mean it's the cause. And there are lots of association studies that get lots of press, like grapefruit juice and Viagra and caffeine, but there's have to have a biological basis that makes sense. And I'll get into that a little bit more as we go along. So in melanoma, since the 1970s, there have been more than 20 studies with nearly 7,000 patients and 6,500 controls. In basal cell and squamous cell cancer, there have been very numerous studies with lower numbers of patients. And here's the data, kind of a simplified version. Sun exposure in different forms, either your total lifetime exposure, whether you're the farmer with the occupational exposure, or the water skier with the intermittent exposure, and whether you had sunburns, and not just in childhood, which was received a lot of attention early on, but sunburns at any age. So you can see for squamous cell cancer, the more sun you have, the more chance you have of getting squamous cell cancer, so a 50% increased chance if you have lots of sun exposure. And if you're the farmer, you have a 60% chance of getting squamous cell cancer. But if you're the water skier, it doesn't really increase your risk for squamous cell cancer, but it does increase your risk for basal cell cancer and especially melanoma here. You can see that that's the pattern of sun exposure that's most linked with basal cell and melanoma, that intermittent recreational sun exposure, and especially sunburns, for melanoma. So the answer was that the farmer is more likely to get squamous cell cancer, somewhat increased chance of basal cell cancer, but really not at an increased risk for melanoma. But it's the water skier, okay, the recreational weekend warrior type who really has the pattern of sun exposure most associated with melanoma. Now, melanoma incidence has been increasing for many years. This is a graph showing the number of cases per 100,000 people in the population, and you can see back here in 1975, it was probably about 8, and then by 2013, it was almost 25. But I could show you this graph starting in 1930 with statistics from the Connecticut Tumor Registry, and you can see this trend has basically been going on since the 1930s. So we were interested several years ago of saying, well, why did this happen over the course of the 20th century? And it turns out we did some research on this, and cultural and socioeconomic changes in the 20th century were associated with the rising incidence of melanoma. So before 1910, there was a stigma against tanning, and people didn't really have a lot of leisure time to spend outdoors, and also clothing styles were such that there wasn't really a lot of skin exposed. But in the 1910s to 1930s, tanning became more desirable as a measure of health. There was more leisure time available as society became more wealthy, and fashion changed so that more skin was revealed. In the 1940s to 1970s, tanning became highly desired as a sign of affluence and health. There was a lot more emphasis on outdoor recreation. Think of all the parks and sporting venues where people would play, going to the beaches, and again, more and more skin revealed. And then in the late 20th century, indoor tanning became popular, and even more skin was being revealed. And here's some diagrams. If you can look here, here's what people wore when they went to the beach in the early part of the 20th century, and we can see how that progressed here to exposing more of the leg and the arms. By the 1940s and 70s, the bikini had come in, so there's even more skin exposed and even more later on. We were able to measure or sort of estimate the amount of skin exposed using something that the surgeons refer to as and the dermatologists as the rule of nines. And we were able to kind of quantify how much skin was exposed. Likewise, this is a bathing suit for a man in the 1900s. But by 1910 to 1930, you could see that the sleeves are gone. This guy's wearing a tank top, so his arms are exposed, and more of his thighs and legs are exposed. And then, of course, by the 1940s, we had sort of just a current contemporary style of bathing suit with the entire upper body exposed. And again, this is an association, but if you take the amount of skin exposed here and plotted on a graph. And then you look at the melanoma incidence curve here, and I caution that we did lag this by about 50 years because there's sort of a lead time to get melanoma. You don't get it as a child, but you have all that sun exposure. You can see that these basically go up in parallel, both for women and for men. So of course this is just an association, but it's biologically plausible. Now, before I get more into how sunlight causes melanoma, I thought I would explain that there are 4 main types of melanoma. Superficial spreading, which is about 50% of cases. Nodular melanoma, particularly dangerous form of melanoma, is about 20% of cases. Lentigo maligna, another 20%. And acral lentiginous melanoma, melanoma of the hands and feet, only about 10%. This is a classic picture of a melanoma superficial spreading type. You can see it's got what we call the ABCD features. It's very asymmetrical. You can't really divide it in half and see equal portions on both sides. It has this irregular border. It has multiple colors, and it's quite large. We don't have a ruler here, but you can tell by the hairs that this is really quite a large lesion, more than 6 millimeters in diameter. This commonly affects individuals between 30 and 50. Of course, it can affect people who are a bit older or even a little bit younger. And it can really occur on any site, but typically on sites of what we call intermittent sun exposure. So you can imagine that water skier is exposing parts of the skin, like maybe the back or the arms, that wasn't exposed all the time, but just intermittently on the weekends. Nodular melanoma tends to affect older patients. You can see it's really just this nodule, okay, without much sort of horizontal component to it, just a little bit here, a brown pigmentation here. These grow very rapidly, commonly on the trunk or the head and neck, areas of chronic sun exposure. Lentigo maligna is sort of the opposite. It grows much more slowly, also typically located on the face, but this is really the results of sort of a lifetime of sun exposure, and this is mostly found in individuals over the age of 60, or of course if you live down in Australia and New Zealand where they get so much sun exposure, you can see this on younger individuals. And acral lentiginous melanoma, you can see here, this is a sort of very ill-defined, irregular, dark lesion on the bottom of the foot. There's probably maybe a little bit under the toes here. Multiple colors, very irregular. This is a melanoma on the bottom of the foot. These also typically in older patients, palms and soles, not related to sun exposure, biologically a very different form of melanoma. And when we look across different racial groups, blacks, Hispanics, Asians, or Caucasians, all get this at about the same rate per 100,000. So it's sort of a different form of melanoma, but still melanoma. So I told you I would tell you how sunlight causes melanoma. So I just want to get everybody on the same page with respect to the genetics, because that's so important in cancer. So we know that genes carry information in the form of DNA, and that's for cells to function. So the DNA is really like a blueprint, and shown here, and that tells the cells how to function. Cells are kind of like the frame of a house. They're sort of the frame, if you will, of human beings. Now, mutations in the DNA cause cancer cells to misbehave, and these changes can be sequence changes in the chemicals, deletions of portions of the DNA, extra copies of DNA, or modifications that change the expression of genes, sort of the turning on and off of genes. And many people like to refer to cancer cells as automobiles, but they're kind of dangerous. They didn't pass inspection because they may have a stuck accelerator pedal, which we call an oncogene, and that can result from these sequence changes or extra copies of genes or turned on, or the defective brakes, which means a loss of a tumor suppressor. It could be from a deletion or some silencing of genes, and it causes these cells to basically behave out of control. Now, both UVA, I mentioned those wavelengths, UVA and UVB cause damage to skin cells. UVA is really very abundant at the surface, but it's less intense than UVB. It causes photoaging, but it really doesn't cause burning. But it does damage cells. It indirectly damages DNA by creating chemicals in the cell called free radicals that can cause lots of damage to lots of parts of the cell. And it causes the immediate skin darkening. So if you go and get a tan, let's say outdoors in a park or a beach, and you look the next day or maybe that evening and say, gee, I'm tan already, that's really because you had a temporary tan from the UVA reaction in your cells. UVB, you can remember B for the burning rays, A for the aging rays. It's a less of a proportion of the energy on the surface, but it is the chief cause of sunburn, and it directly damages the DNA. And people sometimes say, well, is there such thing as a safe tan? And I say, well, it's really hard to say because tanning is the skin's protective response to DNA damage that's caused by UVB. So basically someone who's tan is telling you that they've had damage to their skin and the skin is trying to protect itself. Now, unrepaired damage leads to what we call signature mutations. And this is an analysis of a melanoma, and the different kinds of mutations are shown here on the vertical axis, and the number of mutations is shown here on the horizontal axis. And you can see here, and we know that certain changes are due to certain agents. So, for example, smoking produces certain changes, and ultraviolet light produces certain changes. So this is a UV signature mutation here, and there's just a huge number of mutations, and they're predominantly this signature. So the UV signatures are really the smoking gun of sun exposure in melanoma. Here's a melanoma under the microscope. I showed you cartoons before, but you can imagine the ultraviolet light rays coming down and really pounding these skin cells. They're trying to keep up by repairing DNA, but once they don't do that, these cells here have all of these mutations, and they're really these out-of-control cars that are starting to grow where they're not supposed to be growing. Now, what about indoor tanning? People often ask about that in the relationship to sunlight. So indoor tanning is mostly UVA radiation. We use UVB indoors for medical treatments. That's completely safe from a skin cancer point of view. And you would need much longer exposures of UVA to get a burn like you would in UVB. And this was a report from 2009 showing that there were more tanning salons in major cities than there were Starbucks or McDonald's. So tanning is really, really prevalent. I think a landmark study in the evidence for indoor tanning causing melanoma was from Minnesota. Colleagues of ours did the Minnesota Skin Health Study. They had 2,300 cases and controls from the Minnesota State Cancer Registries, and they collected all kinds of detailed information about their UV exposure history, including outdoor and indoor tanning. And you don't have to look at the details here exactly, but just one of the things that was so powerful about their study was they were able to show a dose effect. So the more hours of of indoor tanning you had, the higher your risk for developing melanoma. And importantly in this analysis, they adjusted for many other variables. So they asked people, well, how much time did you spend outdoors? And when they controlled for the outdoor exposure, there was still the association with melanoma and indoor tanning. And both the UVA emitting devices and the UVB enhanced devices showed increases in the chance of getting melanoma. So moving to the last portion, who gets melanoma? Well, these are a bunch of cute kids of different kinds of pigmentation, skin and hair pigmentation. Anybody can get melanoma. Of course, much more common in the fair skin population than in the darker skin. But as I mentioned, darker skin patients were especially concerned about melanoma on the palms and soles. So a little bit more about genetics. I mentioned about DNA is a blueprint, and the DNA can encode traits that are visible like hair color, brown or red, but there's also non-visible traits, such as ability to repair DNA damage. And the traits that are associated with melanoma risk that we can see on the skin, a patient comes in with an increased number of moles like this person here, we automatically know this patient has a greater chance of getting melanoma because of the presence of those moles. Freckling, and also light-colored pigmentation here. This is Troy Aikman, red hair, very fair skin, is a melanoma survivor. And then the hidden traits of DNA repair. And we know mostly, unfortunately, a very rare condition, xeroderma pigmentosa, is an inherited disorder with a lack of being able to repair UV damage, and they have a 1,000-fold increased risk of skin cancer, melanoma, and a 5,000-fold increased risk of other skin cancers. And you can see this is a child, very unusual to see a skin cancer on a child of that age, and that's because that child can't repair the DNA damage from the sun. So I've told you a lot of stuff to try to kind of wrap it up together here. Basically, you have normal cells that get exposed to sunlight. If you're a person who gets lots of moles, we think that you don't need a whole lot more sunlight to develop melanoma, so you get melanoma at a younger age of that superficial spreading type. But if you're not a person with that predisposition, you probably need more sun over time to develop your melanoma. and that's at an older age. You can see this person has lots of sun exposure here, and they are the ones who tend to get the lentigo malignant melanomas. Now, this is just a paradigm, a way for us to think about it. There's obviously a lot of room in the middle and exceptions, but we think this does hold up when we look at other scientific evidence. So melanoma really is an interaction of personal risk factors, fair pigmentation, poor tanning ability, having lots of moles, and of course having a family history. And then environmental factors, we talked about UV exposure, sunburns, indoor tanning, and of course latitude. If you live closer to the equator where the sun is stronger, then you can get increased chance of getting melanoma. These personal factors are encoded by genes, and many of us are working on trying to understand the genetic basis so we can help even more precisely identify people's risk. So finally, just a few thoughts on sun protection. Can sun protection prevent melanoma? Well, basically, the evidence for sun protection strategies comes from that case control study that I mentioned, and then a clinical trial that was done in Australia. And I think the bottom line is that protective clothing and or sun avoidance is a more robust measure, a more method of sun protection. It really likely provides the best protection. In studies, you didn't have to have consistent use of protective clothing or sun avoidance, and those people still had a melanoma reduction. Of course, the people who were really more committed to it had an even lower chance of getting melanoma. Sunscreen may provide some protection if used optimally. It's thought to be not the best form of sun protection, and the truth of the matter is that the large majority of people, anywhere from 50 to 85% of people, don't use enough sunscreen and don't reapply. So when people say, what's the best sunscreen for me to use? The answer really is the best sunscreen is the one that the person actually uses, because there's actually lots of good sunscreens out there. So this child here looks well protected pretty much to me. Unfortunately, Dad is kind of old school there, not on the bandwagon, and still exposing his back, which is the most common location for melanoma in men. And really the best prevention is early detection. Melanoma is highly curable when diagnosed early. These are different forms of cancer. Melanoma here you can see when caught at the early stages where it's just confined to the skin, 98% for survival at 5 years, but this drops off quite dramatically when the cells have escaped the skin before this cancer is removed. So in conclusion, melanoma results from the combined effects of excessive exposure to ultraviolet light causing damage to melanocytes in the skin. Ultraviolet light sources include sunlight and indoor tanning equipment. Individuals who inherit genetic variants for fair skin and hair color and many moles are particularly susceptible to melanoma. Sun protection should be followed diligently to reduce the chances of developing melanoma. And again, the best prevention is early detection. So I'm going to put in a plug for May. The month of May is Skin Cancer Detection Month. It was already mentioned we do our free skin cancer screening here at NYU. So please come and have a skin check. And thank you for your attention.